the HPV vaccine in the US is Gardasil 9. The Gardasil 9 vaccine efficacy trial did not use an inert saline placebo. It says served as controls, another vaccine. So they compare one vaccine to the older vaccine. It's like saying, my right hand punched you in the face, and then my left hand punched you in the face. And because the damage was similar, my fists hitting you in the face are safe and effective. The package insert. They have breakouts in the 3 groups. One got the Gardasil HPV vaccine. The other got this aluminum injection, AAH. So basically this is like the adjuvant that they add to the vaccine. Another way to say that or look at it would be the active ingredient, or the ingredient that causes harm, the ingredient that does things to the human body. And the other one just got a saline placebo. And so injection site markers, if we look at just the vaccine versus the control, there's a little bit reduced pain, a little bit reduced swelling. But then if we look at the saline, we can see it's significantly less. And so it's like, oh, interesting. And then when we get down to more serious adverse reactions, upper respiratory tract infection, that's another name for COVID, myocarditis, where have we heard that one before? They combine the saline placebo, the thing that did nothing, with the aluminum injection. So why would they combine those? Well, if we look at the results, they're almost identical, very similar. So it makes it look like there's no difference between the vaccine and the control group. Why would they break out saline in one category, but then in the more serious things, they combine it? Obviously, it makes them look better. And eventually I found this FDA review of it. And if we go down to page 45, serious adverse events following vaccination, appendectomy, chest pain, allergy. What I found interesting is it says varicella infection with a seizure. A 22-year-old black male gets an injection and shortly after develops chickenpox, otherwise known as detox symptoms, as the body trying to get rid of poison, and had a seizure. Another person, they say he has a history of asthma and peanut allergy. Well, vaccine critics say that it's the vaccines that cause asthma and peanut allergies because they have peanut proteins in some of these vaccines, and when they inject it, the body sees it as a hostile invader, and so it has an anaphylactic reaction to peanuts. And they say, oh, he's hospitalized and intubated for 12 days after the dose. 15-year-old white male who had a ventricular arrhythmia 27 days after the second dose of the Gardasil, had an aneurysm and died. And they say, oh, the autopsy was inconclusive. But within a month of getting an experimental injection, he dies. I mean, 15 years old. What else would it be? I mean, if your kid, your child, your baby gets an experimental injection and dies within a month, what would you think is the cause of death? Peanuts? Just a coincidence?